the name of dozens of healthcare workers who died in the 2014 Ebola outbreak. The names are displayed outside a hospital in Kenema, one of the worst-hit cities during the 2-year outbreak that killed nearly 4,000 people in Sierra Leone. Mohamed Feika, a healthcare worker here, recalls how many of his co-workers died after contracting Ebola while caring for patients.
That greatly affected me, looking at my, some social activity as well. You as well, let me just ignore myself. Let me look at other people.
Now there's an Ebola vaccination campaign to protect healthcare workers like Feika. The Gavi Vaccine Alliance in June launched a preventive Ebola vaccination program to help contain the disease and protect critical healthcare and frontline workers in high-risk countries like Sierra Leone.
There was that kind of fear among healthcare workers, even among the entire population. So upon taking the vaccine, I now have the confidence that maybe when there is an outbreak, I will not be infected.
The single-dose vaccine is being provided to healthcare workers in countries that have had Ebola cases and those that border countries that have experienced Ebola outbreaks.
It's going to be 20,000 vaccines to start with, and we feel this is sufficient to cover the frontline workers I've just mentioned and protect those that are most vulnerable. And then, of course, we will be replenishing the stockpile so that we still have that 500,000 and then moving to other countries that are at risk of high risk of Ebola outbreaks.
The Ebola virus is spread through contact with the bodily fluids of an infected person. The average fatality rate for Ebola is about 60%, according to Gavi. Since Sierra Leone is considered a high-risk area, the government has set up a public health agency to enhance detection of the disease and prevent further outbreaks.
We know we are in an endemic zone. We know it's only the matter of when and not if that will be an outbreak. Every week we have a suspected case that we have to respond to. So a dedicated agency has been created to just look at that, preparedness and response.
As part of the campaign, community and religious leaders are encouraging the public to accept the shots. The Reverend Usman Fona is one such leader.
We use the pulpit. The mosques use the mimbar. The churches use the pulpit on Sundays and on Fridays, at weekday meetings, also at naming ceremonies. When we go to name children, we'll let the congregation that are present to know the value of vaccination.
More than 11,000 people died during the Ebola outbreak in West Africa between 2014 and 2016, most of them in Sierra Leone, Liberia, and Guinea. Authorities hope the Ebola vaccination campaign will help avert such a disaster in the future. Victoria Amunga, VOA News, Kenema, Sierra Leone.